Thank you so much for that, Sam. We really appreciate it. I'd like to pass on to Alex Craven. Thank you.
Hi, everyone, and thanks for having me. It's an honor to be here. I'm joining you from the lands of the Wurundjeri people of the East Kulin Nation, where I'm proud to live and work. I am going to talk about metabolic or bariatric surgery, and this was a hard talk to prepare because I'm a proud Australian and I'm very proud to work in our public healthcare system. But when the theme is inequity, and being a doctor, a father, and a healthcare worker, I need to call out a very real, deliberate discrimination in our public hospital system against people with severe clinical obesity. Discrimination that's causing harm, disability, and death regularly. Obesity is a disease of genetic susceptibility, and it's present wherever populations have consistent access to food. Prevention and management is definitely getting better, but some people slip through the cracks due to factors well beyond their control. Some of those people have severe clinical obesity. This is where disabling or life-threatening diseases are caused directly by their obesity and are only managed effectively by effective treatment of their obesity. For many people with severe clinical obesity, metabolic or bariatric surgery is the most effective, life-saving, and cost-effective treatment available, and in other cases, it's simply the only sensible option. Despite all this, I'm sorry to say, despite overwhelming evidence of benefit and cost-effectiveness going back decades, access to this surgery is systematically and specifically denied in Australia's government-funded hospitals. Over 95% of Australian public hospitals simply refuse to provide this essential surgery. Many others are imposing arbitrary and unjustified restrictions on case numbers or resources. And this is despite metabolic surgery being a standard part of care for multiple medical conditions. By refusing to allow access to metabolic or bariatric surgery, our government-funded hospitals are actually failing to meet modern standards of care across a number of medical fields. The saddest part for me is there's absolutely no rational reason why it has to be this way. Metabolic or bariatric surgery in this country is funded in public hospitals no different to any other surgery type, and existing resources in most hospitals could support this starting tomorrow. Dedicated healthcare professionals in public hospitals around the country are desperate to provide this, but are repeatedly blocked by their administrations, simply based on stigma. Meanwhile, the same hospitals will spend taxpayer money and their patients' health on less effective, more costly treatments for the predictable and preventable complications that occur when we neglect to provide metabolic and bariatric surgery for people with severe clinical obesity. When most of the people seeking this treatment form are women, blocking it is discrimination by neglect. When First Nations people are overrepresented in those most at need and with the worst access, this is discrimination by neglect. When only a tiny percentage of our hospitals actually step up and provide this standard treatment for severe clinical obesity when people need it, this is essentially a postcode lottery for the lives and health of Australian people. This isn't the only problem. It's not the solution to the be-all and end-all, but of all the problems we're going to hear about today, this is the one we can most easily fix and fast. It just requires the will to allocate existing resources fairly and based on clinical need rather than stigma and deliberate discrimination. All I'm asking for is people to call it out. If your hospital provides surgery for the complications of obesity, but not metabolic surgery for the biology of obesity, call it out for the bad and ineffective practice that it is. If you have influence on healthcare leadership and your institution is blocking access to this surgery, fix that. And if you work in the community healthcare and you're watching people develop disability and disease that could be avoided through lack of access locally, speak up. Demand better for your patients. And all of us talk to your MPs, let them know it's unacceptable that people are suffering and dying due to deliberate and systemic neglect of this one critical area of medicine in Australia. I'm going to finish with an apology because there's a lot of people out there living with severe clinical obesity who need this care and they cannot and will not be able to access it. On behalf of the Australian healthcare system, I'm sorry. I'm sorry our hospitals are letting you down. I'm sorry our hospitals are letting people die. It's not okay. We can and should do better. Thank you for your time.
Thank you, Alex. I'd like to pass on to Zineb Malik, our next